Hello, I'm Marcus Boston. Quick video today, and we're going to talk about timing or trying to determine when did the HIE brain injury occur? When might it have happened? Now, I'm doing this video because I just did another video in which I talked about the outlook or the future prognosis for babies who have HIE. And in that video, I talked about how it can vary, how the outcomes can vary. For some children, you may have a situation in which there is very little that we see in regards to the HIE diagnosis. The impact is minimal. Whereas you can have other children, they may have a more severe brain injury, and those children may have more challenges than others. So out of that video came questions about, okay, so how do we know when did the injury occur? And in these cases, especially when we're talking about birth trauma related injuries or birth trauma cases, a lot of times what we will see is the defense or the doctors or the hospitals, what they will do in a lot of these cases is they will try to determine whether that injury occurred what we call in utero. Did the baby have a stroke, let's say, for example, early on, and this is before labor and delivery. And so a lot of times there's a big fight or there's a lot of questions surrounding this issue of trying to determine the timing of the injury. And in a lot of these cases, what we're looking for is what do the initial scans show? Because what will happen is in some cases, if there's a suspected brain injury, the baby may have scans a little bit after birth. And what we're looking at is in some cases, what you will see is those initial scans, they will be normal. They will not show any type of injury. And then when you do subsequent scans a little bit after, later in time, what we can start to sometimes see is then the brain injury will begin to manifest itself on the scans. And so for when we have situations like this, there's a strong argument that can be made that this injury may have occurred during labor and delivery. And that is why you then we use the electronic fetal heart monitor. We use the strips to be able to look and see, okay, what were the strips showing? Were they showing a baby that was in distress? Are the strips showing that the baby had issues with the heart rate? Are there issues with variability and a whole host of other things? So that is what we do. And if you kind of think about it, if the baby has had an injury, let's say the baby had an injury during development or there was an injury before mom got to labor and delivery, if the brain is injured, there's a strong argument that can be made that on those initial scans, that brain injury will have manifested itself because enough time would have passed so the scans will show that brain injury on that original or on some of those original scans. But when you have those original scans and you don't see an injury immediately, there's nothing there, the brain is looking normal, and it's not until subsequent scans or subsequent readings now that brain injury is beginning to manifest itself. There's a strong argument that can be made that, wait a minute, this had nothing to do with mom and dad. This was not genetic. This was, none of those types of things. We're looking to see, was this something that happened during labor and delivery? Was the baby in fetal distress? Did doctors and nurses fail to diagnose that fetal distress? And did they then fail to properly treat it? And that can be, among other things, but in some instances, an emergency C-section is what's going to be needed in certain cases. So that is the purpose of today's video, to help you understand this process, because more than likely, if you're watching this video today, your baby probably has suffered a brain injury, you probably have an HIE diagnosis, or you may be even dealing with a subsequent cerebral palsy or CP diagnosis, and you have questions. You have questions about it. You don't know, was this something that occurred during labor and delivery, or was this something that happened earlier in the process? And you're looking for help in regards to an investigation into what happened. If you have all of that going on and you would like to speak with me further, this is what I invite you to do. there's a telephone number on the screen. Go ahead and pick up the phone and give me a call. I talk with families all the time about these types of issues: HIE, hypoxic ischemic encephalopathy, CP, cerebral palsy, MAS, meconium aspiration syndrome, a whole bunch of other things, birth trauma related. This is what we do. And if you have questions, go ahead and give me a call. Now, I want to also remind you that because this video is on the internet, and that if you are not in Maryland, I practice law here in the state of Maryland. If you're not in Maryland and you would like to speak with me or you call me, you got to understand that if this is something that we think that we can assist you with, or more research or investigation needs to be done, we have to use what we call co-counsel or local counsel. In other words, an attorney that's barred in your state to help with the case or to push the case forward. So I just want to make sure that you understand that local counsel aspect. All right, that's going to be it for today's quick educational video. I know this one is a little bit more technical than what I usually do, but I'm trying to help you get a better understanding of this process and some of the things that we are looking at when we are investigating these cases and helping families get answers. All right, again, I'm Marcus Boston. I'm one of the childbirth, injury, and medical malpractice attorneys practicing law here in the state of Maryland at Boston Law Group, LLC. We will see you next time. Take care and enjoy the rest of your day.